Well, welcome to our Zerine podcast. This is Tooth Truth. I'm Dr. Scott Parker. We're going over the clenching and grinding edition. I am a dentist. I'm a clinical instructor. I'm a key opinion leader for the dental profession. I've traveled the world teaching dentists how to deliver better dentistry and how to get improved patient experiences. As has my guest on the show today, who's joined us before. Both of our passions is teaching. This is Dr. Mike Smith. Welcome, Dr. Smith. Thank you for joining us.
Thank you, Scott. It's my pleasure. I always look forward to speaking with you, seeing you, and being around you.
Very kind. Thank you. So, in this episode, we're going to continue our dive into the world of bruxism. In particular, this time we're going to be focusing on treatment options. What do we do once we kind of have a confirmation that we're dealing with bruxism or clenching? And what does that look like for a general consumer? We can talk about it as dentists, and Mike and I can have a deep level discussion, but we also want to make sure that this is something that people understand as a consumer, like what are the implications and what are the options that are available for us. So Mike, why don't you take just a second to reintroduce kind of who you are and what do you see, what do you do in your practice on a daily basis?
Hi, Dr. Mike Smith. I'm a third generation Phoenix dentist. My grandfather started this process in Phoenix, Arizona back in 1928. So I grew up around everything dental with my grandfather, my dad. My sister is also an orthodontist. So everything that we dealt with was all, teeth, blood, spit, and smiles. Really that's how it goes. I got involved in my dental career as getting into reconstruction, went down a very deep path as far as for jaw joint functions, bite problems, anomalies, clenching, grinding, airway analysis issues, and then how do we solve these problems in our daily general practice for our patients? And then we've taken that now to our biting education programs of how do we teach other doctors to be aware, to be concerned, and how to treat the best way possible for these other pitfalls that we have that we see on a daily basis with jaw dysfunction, with bite dysfunction, and with clenching, grinding type issues with patients.
Awesome, thank you. And just for general knowledge, if you didn't listen to the last episode, I've known Mike for nearly 30 years. We've kind of paralleled each other's paths for dentistry, and have huge respect for Dr. Mike and what he does. Not only from a cosmetic, making things look good perspective, but even more importantly, making sure things feel good and are functionally correct before doing the whole cosmetic side of things. Often we have a saying in dentistry that form follows function. And when we follow the rules of function, usually the form will follow, meaning we can make things look pretty and be stable when we get that joint stable. So really important discussion. We find the corollary to be true as well. When the joint is out of function, the teeth start to break down and things start to look bad. So they go hand in hand. So Mike, last time we talked for quite a bit about what clenching is. What are the triggers? What does it look like? What are the symptoms? We can go back and reference that show, but rather than spend a lot of time reviewing that, because we can do that on our own time, I'd like to start thinking about what is it that we can do as dentists, as treatments for our patients that clench and grind. So why is it important for us to do these things, and what does it mean if we don't?
Okay, so there's a lot of triggers to this clenching, grinding, bruxism type of thing that we talk about. And the overall thing is, if you're doing it, how do we, one, protect you? Meaning, how do we get your bite right? One, or how do we protect it with some kind of orthotic that's in there from keeping you from crashing, bashing, smashing, making things get awry? Or how do we retrain your neurological system to say, hey, I'm doing something bad, And we need to stop this involuntary motion or voluntary motion of clenching, smashing our teeth together, which would be what the Zerine product is going to help us do. And the biggest thing is there's so many reasons that can cause a trigger for bruxism or grinding your teeth or clenching your teeth. It could be neurologic. It could be an imbalance of the bite. It could be an inflamed joint type issue. And it just could be a nervous type habit. Could also be some structural anomaly that you have somewhere else in your body, and you're taking it out on your teeth and your jaw because you're trying to brace yourself to get through that type of an event that you're having somewhere else go bad. So there's so many different reasons. Now, the best way that we can take care of this as a health professional is, one, identifying that the patient does have some kind of clenching, bruxing type issue. The other thing is okay, now what are the modes of us to go and protect this patient with their natural dentition to get things in the best way possible? Or is it something that we need to put some device between their teeth to keep them from crashing, bashing, smashing, causing problems, and then retraining the neurological system to say, stop doing this? And that's what we'll be talking about later with the Zerine product.
Thank you for that. You said a couple things. You know me, I take notes. I take notes when we're talking because there's so many little things that are nuanced in this. Number one, can you tell me, you use the word orthotic.
Correct.
What does the word mean? Like, say I don't know anything about dentistry or joints or knees or hips or shoulders. What is an orthotic? What does that mean for the general?
So an orthotic is a device that you can place between your teeth to help either reposition, protect, or reestablish a better position. And something is generally is removable. There are some orthotics that can be bonded and placed in place where they're not removable, but a majority of them are something that can go in and out of your mouth to make it so you can have a corrected plane or a protection device.
Perfect. And so there's a couple of different things I heard you say that we're protecting. We're protecting the teeth from further breakdown.
Correct.
Because we're distributing the force of the bite across all of the teeth and maybe not just a few that may be out of alignment. So that's one area we're protecting. Number two, we're protecting the joint. Correct. Because we're creating a little separation. We call it a disclusion, but a little separation between the joint and the ball that rotates in there. And that allows a little bit of space so we're not constantly loading or putting pressure in that joint.
Correct. Correct. It also does a couple other things. It can also protect the airway if the airway is being collapsed, making it so you can breathe better. And then it's also can be designed to optimize muscle function. So you're not, we call co-contracting, causing a irregular firing of your muscles because something is wrong.
Brilliant. And your comment about protecting the airway, I really want to go a little deeper in that one, but I don't want to do it in this episode because we've got so many other things to talk about. But that's a perfect thing to put on our future conversations is the airway and why it's so important, and why do we see a smaller airway in people that have clenching and grinding? What's happening there? So
It's
really,
that's an all a constriction thing. I just threw it out there because I'm trying to invite myself back on another episode. So.
I think that's a good option. I'll put that in for a future episode. And by the way, next time we do this, we're going to do part 3, but which is actually solutions part 2. Meaning we're not going to get into everything today because there's just too many options.
Absolutely.
But I want to keep conscious of our time. And then you said something else, which is really important, is optimizing muscular function. So this doesn't sound like it's just a single joint issue. Does this translate to the whole body? Is that what I'm hearing you say?
It can translate down to your neck and down through your cervical spine and your vertebra. It even can go all the way down to your sacrum, which is back behind, right above your bottom, and so you can have a whole body correlation to this system that goes estranged, where you have something out of balance and it can offset your entire system and can cause other neurological, other muscle type of things, and other pain and inflammation. Inflammation is one of the things that we have to be able to maintain, to get rid of, because that can also cause another trigger. The more inflamed you are, the more trigger you can have to clench your teeth, because you're trying to balance out that fluid flow that's there. So inflammation is a big destructor that we have, either in the muscles, in the jaw line, the teeth, or into the joint itself, because that can cause even further clenching and grinding episodes the more inflamed you are.
100%. It's all related. You also said something that I think is really interesting. You said an imbalance in our teeth, meaning let's say we have some teeth that are out of alignment, that can translate down into our neck, into our back, into our hips, and it can create a malalignment. Can it go the opposite way as well? If let's say I have one leg that's shorter than the other, will that translate to the jaw as well?
Yes, it can. Posture alignment has, we call, ascending and descending. Ascending meaning it's coming from somewhere below your head, your neck, causing an imbalance. And that can cause your spine to twist, your head to tilt, which fires other muscles. It could cause your head to tilt forward, which causes an airway restriction, a joint reposition. So there's a lot of things on an ascending disorder that can cause a lot of other structural problems. The descending issue is just as bad, but we usually work on the dental field, the oral health profession field. We're usually working on the descending type issues, because as we stabilize the jaw joint, we can stabilize the neck and the head position to get it to become uprighted again, and to work on that flow going down. So we have a lot of control on the downward motion of the bad cycles of inflammation or structural malalignment.
Interesting. So fascinating. Which is helping me to understand, and we've both been in this field for a long time. We're seeing more and more focus on getting joints healthy. When I look at pictures of people, I notice this all the time. People have a natural head tilt. They have their head tilted to one side or the other. And often that's related to our bite and our misalignment or other skeletal challenges. And
Absolutely.
so a lot of times you'll find more and more dentists today that are taking screening photos of their patient with a grid behind them, so they can see these malalignments and head positions in relation to the shoulders. And
Yeah, and it's not just looking at them straight on, it's also looking at a profile view too, to see what
correct.
else you have with the cervical twist of the spine and that head tilt neck position. So we do look at a lot of those factors to see, is your head on straight? Really, it's kind of what you're looking at, because if it's not on straight, how do you get it back again? And that's what we're trying to look at, is get your head back on straight and make your smile work without you hurting yourself.
And just to be clear, we're talking about teeth when we say get your head straight.
Yeah, pretty much. Yeah, I'm staying in the oral environment here, but it translates down. So we're
Yeah,
trying to make it so
absolutely.
it works right. The whole system's got to work right, because if you have one thing impeding against the other, you got to have some compromise. And you got to see where that compromise is going to take you. Is it going to take that compromise into a good environment or a bad environment? And it all depends on that patient's ability to adapt. Some patients can adapt to a lot. Some patients have a really narrow adaptation level where you have one thing that gets out and it can cause the whole system to become a disorder. So that's where we have to really watch. And that's when it becomes a problem, when you're doing that clenching and grinding and you have some imbalance, either in the jaw line, the teeth, the jaw joint, or the muscles. And then it causes more of the strain and stress to your system that can cause you to have more of a neurological type of an episode system or breakdown to your entire body. So that's why this is such an important factor, is because one little thing to one person may not be a lot, but that other little thing to one other person that's already got the other stressors of instability can throw them way off. So it's a very dynamic type of environment that we have to address on an individual basis, because not everybody's the same and not every head is screwed on straight.
Yeah. And again, just to be clear, we're talking about dentistry when we're talking about our heads screwed on straight.
Correct.
There were times in my life where I think people would question that about me. I was a river guide, whitewater river guide. And so, there's a certain amount of crazy that goes along with that.
Yeah.
Um, so we didn't spend as much time talking in our last podcast about um, diagnosis, or what are some of the, like, how do I know that I have this issue? And this, by the way, is what was so compelling about Zerine and what they're doing. And I've had a chance to use their device, and I've been using it myself. And I was fascinated by the data because it shows me when I'm clenching. It shows me how much I'm clenching. So diagnosis is a big deal, which has never really been available to a general consumer before now.
Right.
Previously, we would have to go into a dentist and have a diagnosis. Can you spend just a minute or two talking about, like, how do you diagnose these conditions, and at what point do you typically see them, and do you wish that you would have caught it earlier?
Oh, absolutely. The earlier prevention that you get, the better and the most conservative treatment that you can offer. So let's go down to the diagnostic, the approach to diagnosis. There's a lot of different ways we look at diagnosing a clenching and grinding artifact on a patient. A lot of it has to do with wear on teeth. A lot of it has to do with positioning of how the teeth come together. Do they come together equally, or is there a hit slide where the jaw has to reposition itself? So you're looking at a lot of clinical signs of tooth position alignment as a patient comes together. Now, other things that we look at are muscle discomfort and pain, along with function. Can they open regularly, or is there some dysfunction in the ability for that patient to open and close, move their jaw side to side, or swallow? So we're looking for clinical adaptation changes that would say, hey, we have something that's inflaming. This inflammation is because of a overstimulation from clenching itself. So those clinical signs are important that we look at. Some of the other diagnostic signs that we look at when we get into biometric analysis, that we're looking at, how does the structure really look? What does our joint equivalence look? What does our joint evaluation look like as far as our soft tissue evaluation versus our hard tissue compression evaluation of the jaw joint, the soft tissue and hard tissue? We use a lot of different mechanisms for that. It can be auscultation or a stethoscope type of a thing, a palpation feel. It can be MRI results, CT results, which is we're looking at a hard tissue analysis, or we can also look at like a joint vibration analysis spectrum to see what is the correlation of hard and soft tissue friction going on. And even we can look into ultrasound type of thing of seeing how much fluid is there and how much space is there when we look inside the functioning of the jaw joint itself. So we have a lot of different diagnostic modalities we look at. One of the biggest diagnostic modality we look at is palpation and feel. Does the patient have the presentation of pain if you push on a structure? Meaning, do the muscles hurt? Does the jaw joint hurt because of fluid inflammation in the jaw joint? And is that also related to a range of motion artifact? Does a patient open normally or abnormally? And so those are clinical signs that we look at. Now, I take it all to the nth degree because I look at a lot of different advanced diagnostic technologies like joint vibration analysis, like our CBCT or CT evaluations, our MRIs and our ultrasounds to see how does this correlate to the entire system that is working or not working correctly, or in the situation for a grinding or clenching patient that's overworking the system, causing more of the problems.
So there's two levels here that we're dealing with. One is getting a professional diagnosis from a clinician like yourself. That includes things like MRI, CT, your joint vibration analysis, which, by the way, if you're not aware, is a pretty technical way of diagnosing joint issues. And there are some really fascinating options out there. We call it the JVA, and it's just a really great tool. Ultrasound, those are things you'll see in a clinician's office that's dealing with these. But for a general consumer, a couple of things you can do is like, are you sore? in
Yeah.
your muscles. Can you push on a spot and say, wow, that's actually really sore there? Same thing in your joint. When you open, is your jaw opening normally? Is it opening in a straight line, or does it deviate to one side? Do you have a popping in your joint? These are all things that you can be aware of with palpation, feel, but also listening to those types of sounds.
One
So
of the big things that we see clinically that the patient will come in as an observation is when I bring my teeth together, it feels like I'm always searching for my bite. I don't feel like I can bite normally all the time. I'm always searching. Now that's an observation of you've got a lot of inflammation going on. Muscle inflammation, joint inflammation, that's hampering your ability to bring your teeth together in a normal spot all the time. That's one of the early indicators that a patient will notice. Just like you said, the pushing and you have soreness, the trying to eat through a meal and your jaw gets tired, staying away from certain foods because you can't open your mouth wide enough to eat it, or you try to chew something and your jaw either hurts, gets tired, or you just don't have the fact, I just don't feel like I can chew. And then your bite not coming together consecutively, normal, where you say, I'm always hunting for where my bite needs to go. Those are observational things that a patient can see very easily if they're aware, and they're just kind of saying, is there something going wrong? Well, if there's something going wrong, you feel that you have that discomfort, the tiredness, or you're searching for a bite, then you may need to get some other advice to see what's causing this problem.
It's amazing because there's the professional level, there's the consumer level, and a lot of times I've talked to patients that have been years and years and years with this problem, and I ask them, why didn't you come in sooner? And the comment was, well, I just didn't know, but I also didn't really want to pay for a solution. So that's
Absolutely.
yeah, and that's a reality. I mean, we know that's people's reality, but at the same time, there are some things that are coming available today to help, which again, Zerine being one of those tools because it can actually help you diagnose, but it also has biofeedback, which will respond to the, say, clenching and grinding, and it will give you a little gentle vibration that says, hey, stop clenching.
Yeah.
So very, very helpful for that.
One of the great things I think with that whole process of the early diagnosis with the product, with especially with the biofeedback recognition product, is a patient can get into a protected or at least a proper diagnosis because they understand that, hey, something's going wrong. And early detection and early diagnosis leads to more conservative treatment. Like in my practice, being a heavy in TMD or TMJ dysfunction, where I get patients sent to me from all over the United States, these are ones that have gone so far down that now they have to have some really advanced treatment to get fixed back up again. So the earlier the recognition and diagnosis, the more conservative that over end all treatment can be. And really, it's so much worthwhile to have early detection. And that makes a big difference with the overall comfort level and therapy for the patient.
100%. Yeah, thank you for sharing that. It's really nice to be ahead of that game, and it really does save money in the long run if we can go more conservative.
Absolutely.
There's a lot of tools on the market today. A lot of people are wearing rings that give biofeedback. They can check your blood oxygen levels. They can check your heart rate. All these different things today, and these types of things are becoming more and more common that are available on the consumer market. Previously, to do a blood oxygen, we'd have to go into the doctor's office. They'd have to use special monitors. Then they got those little ones you slip on the end of your finger. Now we can wear it in just a simple little ring that detects your blood oxygen. So really, really neat to see these changes. So let's shift a little bit and let's start going more into some of the treatment options that we have. And what do some of those look like? And we're just going to kind of stay on the surface of this one. We won't want to go too deep yet. But what are some of the possible, or I would say common treatments for clenching and grinding that you find to be somewhat effective in your office? I'm not looking for the ultimate solution, but what are some of the early approaches we can do that aren't like super advanced treatments?
You know, there's the simple factor of having a bite guard. You know, people know what a bite guard is. You put it between your teeth, you bite, it guards your bite. Okay, that's a very simple approach. Now, that simple approach can lead to, hey, do I need to, one, move my teeth around because my teeth are so constricted that I can't get them together, right? Do I need to work on my bite relationship? Because as I bring my bite together, I'm moving things around where it doesn't fit. So it could be a bite refinement where you're polishing things up on the bite to get it so they fit better. It can be laser treatment where you can deflame the area to cause the muscles to start to heal and decrease the pain. We generally do a lot of combined treatment where we look at some kind of orthotic that the patient wears or something that goes between the teeth that are removable that can get it where it can reset the structures in the system, and it can get it so you can get things to start working right, decrease the inflammation, decrease the pain, get the patient back into a normal functioning range of motion without causing them to hurt themselves. And a lot of this treatment is designed to get the patient into a basal level that is they're not hurting themselves and let the structures heal and de-inflame. And there's a lot of ways that we can do that. It just depends on the situation. As I said, every patient has some individual needs that we look at, where as far as very simple analysis, as far as simple treatments, can be, just think about this, something that comes in and out of your mouth that you wear, moving the teeth to the right position, fixing the bite, getting the muscles and the joint to correspond and work right with the way the teeth are together. So those are the very simple type of things that we look at. Get it so you don't hurt yourself with your daily function.
So let me just review this so I make sure that we've got it and that we have this kind of locked in. We can do a removable appliance called a bite guard. And I know there's several different options of those. So let's talk about those here in just a minute.
Right.
We can move teeth to get better alignment. We can use lasers to reduce the inflammation. So we're talking now specifically about infrared or like red light therapy style lasers, which
Or
are
stronger, but yeah.
or stronger, but still in the infrared range,
Right.
that are really excellent at reducing inflammation.
Right.
We can use injectables, whether it's maybe Botox
Right.
or stem cells or PRF or some of these PRF. Can you spend just a second talking about what PRF
Well,
is?
PRF is we're spinning down the blood proteins, taking the good components that are high in rich nutrients and putting it back into the system to allow the body to heal.
Yes.
So you're taking the body's components to allow the body to heal. You know, and we take that a whole nother level when we look at a lot of our advanced treatments with PRF and the combination of stem cells to regenerate tissue that's been broken down. And that is a process that really can help stimulate. And when you're talking about very advanced type of treatment for a very specific breakdown of a condition. So, you know, before we thought once our tissue is lost, we're lost forever. Well, we're changing that now with that type of therapy that we can actually grow tissue back to get back into an environment that you can actually grow something back that you thought you never would be able to.
Incredible, incredible. And Mike, I've seen some of your cases and they're almost unbelievable, but we have confirmation we can actually see the physical changes in the joint through x-rays and diagnostic imaging. So truly remarkable. And then of course the last option would be like a surgical intervention with a joint replacement.
Yeah.
Always a last
And
resort.
that is absolutely the last type of a situation. And in that, with some of our other advanced treatments that we have now, some of those total joint surgeries, we're getting less and less and less. We may still have to go in arthrocentesis wise and clean out debris that's been broken down and collected in the joint space. But we're taking some of those big joint cases where we don't have to do that surgery where we cut off a joint and replace it with an artificial one because it is a very complicated jaw joint. So,
Yeah, the jaw joint is so much more complex than just a knee because it's constantly moving. You just don't have a choice there. So,
yeah.
so thank you for going through those. Let's go back. Let's talk about bite guards. There's several different removable appliances that we can make. There's ones you can get over the store, whether those are we call them boil and bite mouth guards. You can have little ones made online, which are semi-custom. I don't call them custom. Custom ones would be made in a dental office. What did those look like? Like, what are the options for removable appliances to help?
So, it's really interesting the way you say that is because when you start looking down the therapeutical index of what do we have to use, any bite guard type of a situation, orthotic we put in the mouth, there's only two that are available as far as type wise. Okay. You say there's probably 300 to 400 names of different ones that are out there, but there's only two that we talk about. One is something that keeps the joint in one place. Okay. It's called permissive. It keeps the joint and lets the joint work in its normal environment. The other one is a non-permissive, where it's moving or dictating a position. So it's either holding a position or dictating a position, moving the jaw or holding the jaw in one place. And really, that's all you have. But we have tons of different names. And they're all designed with certain mechanics that are involved with it. Now, we look at certain type of, we call permissive appliances, and we certain types of shutdown appliances where we can actually shut the muscles down. Okay, those are typically we call an anterior-only type of appliance that goes between the anterior teeth, and it acts like a decreasing fulcrum, where you can move the force away from the muscle base, which is back towards the back, and it can help shut down the muscle. So an appliance like that is great for the solution of a patient that is overcompressing and causing muscle hyperactivity or joint inflammation from clenching really hard or compression. It helps to shut the muscles down. The more you shut the muscles down, the least amount of pressure it goes into the jaw joint. Two, we have a permissive type of appliance. It's a full appliance that goes across all the teeth, and that functions as a new biting layer. Now, the problem with that is it can excite the muscles because all you're doing is replicating a position, but you're also putting muscles back in it to make the muscles continue to work. So it protects the teeth. It can protect the jaw joint, but it may not be the best for the muscles in that respect. Now, those two are really we're looking at is something that we put in place in a patient that has a relatively healthy jaw joint, where they still have a jaw disc assembly that's there. Now, if we get a patient where they have a structural issue, where their jaw joint is getting pushed back against the back wall, either one side or both sides, we call that a dislocation type of an issue with a jaw joint. As it dislocates further into the back part of the jaw joint, it's where you're pushing on the blood vessels, the nerves. It causes that pain, that ringing in your ears, that dizziness, that severe pain in front of your ear that transmits through. Well, those are patients that need some kind of a non-permissive or a decompression appliance. That means it has a dictated movement that's moving the jaw joint back into a corrected position to take it off the structures that are causing pain. Those are designed in many different ways, but really all we have are two different ones. One that holds the jaw joint in one place, the other one's moving the jaw joint into a corrected physiological place where it's corrected.
So you mentioned a couple things, and I want to review this for general consumers because I knew exactly where you were going with this. We really have
you know me so well.
Three things we can do. One is we can use an anterior-only piece, something that keeps these posterior teeth from functioning. Your back teeth cannot function in that device. And what it does is it's like when we used to go to the doctor and they'd hit you in the knee to check your reflexes, our knee automatically kicks out when we get hit just below the kneecap. That's a common reflex test. Well, with this one, there is a nerve that when we hit on the front teeth, most people cannot clench down. Now, some have learned to override that nerve. And so that's why we put this thing in the front, because most people can't really clench hard on their front teeth because of that neuro-inhibition. The nerve actually sends a signal, says, don't do that. Right. So that's one type. The second type is any type of device that fits over all the teeth, which still allows us to clench down. So we're not dealing with the reflex, but our joints are pretty healthy in that situation. And so we can get away with just kind of keeping something in there to keep those dislocated.
And that keeps it from causing the smash, crash, bashing type of situation that can wear teeth, break teeth, and cause things to hurt tooth-wise. And that's what those are designed for.
Yeah, perfect. And then the third one are for people that have had some structural breakdown and we need to take the pressure off of the joint. So we call it discluding the joint, meaning we're pulling the joint away from the fossa or the little hole that it fits in, so that we keep the pressure off that in hopes of reducing that and allowing that joint to stabilize. Unlike, say, a runner who's trying to heal from running, who just keeps running, that knee will never get better. So we're trying to take the pressure off of it. So those are excellent. Now, when it comes to things like a boil and bite, and these are things that maybe people recognize, say you played sports, you go to the Al's sporting goods store and you buy this little thing, you put it in hot water and you bite into it and it protects your teeth. The challenge that I always ran into with that is for a lot of patients, that's like a chew toy because it's kind of gummy. And so we end up clenching even more because we're sitting there chewing on it because it has a little bit of give to it. And it's like a plaything for our teeth. And so one of the challenges I ran into with those types of devices is that it seemed to sometimes increase the inflammation while protecting the teeth. It actually can sometimes lead to bigger challenges in the joint.
So let me break that down of why they're effective, okay, and how they work. By getting your teeth being apart, it's anytime your teeth are apart, your jaw joint's moving. As your teeth open up, your jaw opens up. It's also repositioning your joint so it's not put all the way in the joint space. When you're wearing that for sports and impact, it's keeping your jaw joint from getting traumatized to getting pushed back up in the hole too far that can cause damage. Okay, it's a protective device that can keep you from getting hurt because it's not letting you get pushed your jaw joint all the way back up. And that protects that environment. Now, that's a good thing. So we use those all the time for athletic type injury performance things to get it where they're not causing, they can have a trauma that causes the overcompression, can cause concussions, can cause fractures, all that things that goes along with the overcompression of the joint. Now, they do work and they work well, but they are designed for an impact, a sports impact. They're not designed for normal wear. Now, even it's kind of part pliable, part not pliable, being the boil and bite. It works great for a muscle situation for 2 weeks. Okay. After 2 weeks, it actually causes inflammation, like you were saying, a chew toy, because then you're getting muscle rebound and your muscles now are playing with it. Muscles get more inflamed, joint gets more inflamed, and then it puts you back into this more of a pain threshold that can cause a lot of different issues. And so they work for a short term, but they are designed for sports athletic injuries while you're playing, not to be designed for wearing overnight, not being designed for wearing all the time, because that's what they're not designed for that. That's the use is not there. So, but they are great for a short-term protection device.
So to avoid acute injuries.
Acute injuries.
Facial injuries, yeah.
Correct.
So, so that's a inexpensive way to protect our joint and to protect our teeth for trauma,
Correct.
but not so much for chronic trauma, which comes from clenching and grinding. Correct. So then we have a couple of options to discuss, which is, say, an over-the-counter mouth guard or a custom-made mouth guard. I like to call them orthotics, but still the same thing, and a mouth guard, which would be made by the dentist. What's the difference between those two?
So really, it's all depending on the patient's symptoms. Now, one that you buy over the counter that you put in is a generic fits all. That may not be the situation that you need to treat, because you have to determine, are you treating a joint only issue or a muscle only issue or both? And that's where we have problems with the standard, hey, let me buy this over the counter, let me throw it in, because every individual patient has specific needs and requirements to get them better. Meaning we have to treat what's really going wrong. And those ones that you buy over the counter, they, as I say, they may work for 2 weeks because you're breaking the cycle. But what happens after that? And I don't mind it when a patient says, hey, I tried this. I bought it at wherever. I tried it. It worked for a while. Okay. Now it's not working, right? Yeah. Well, it can be a training tool. They now know that I got a problem. That problem was fixed short term. Now it's not fixed anymore. What's wrong? And so it does drive them to get the best advice possible, to get something done by a professional to say, let's get this fixed the best way for your individual needs, muscle, joints, airway, whatever it may be, or a combination of all of them to get it to be protected. Now, one of the things about the in-store options that you buy that are over the counter, they are a little bulkier. When they put them back in between the teeth, you also have to worry about, okay, what is this doing to the jaw position? Is it going to harm or hurt? Because you don't really know. And then what else is it doing to your tongue and your airway? Is it going to collapse you, where now you're going to have an airway restriction issue, a breathing problem, an apnea type issue that goes along with restricting the airway, because now we got something too big in there that's causing an artifact that they can't breathe. And so those were what I worry about. But honestly, Scott, I have no problems with a patient that says, hey, I think I have a problem. Let me try this. Great. Try it, because it's a good diagnostic tool. It gets them to say, goodness, I am clenching or grinding my teeth. I can see it. I can see the indentations. I can see that it worked for a short time. Now it's not working. What do I need to do to get me better again? So it can be a diagnostic tool to say, I got something going on. I need to get to a professional to get it fixed. That's where I really like the whole Zerine product. Is it's an early awareness product that a patient can wear, utilize it. And when they start seeing, oh, I have this issue, what do I need to do to get it fixed? And that's where I really like this, is because it's an awareness issue. Because a lot of patients, when they come in and they say, I'm having this problem, and I say, you're clenching your teeth. Patients go, I don't clench my teeth. It's like, okay, well, I already see you do. What do we do to make it so it's protected? So getting them on board by having them do an over-the-counter thing is great, because being on board means they're receptive towards treatment to get healthy, to keep healthy, and to keep from breaking down, to have systemic breakdown, chronic pain anomalies, or chronic breakdown where it causes a permanent adaptation and injury.
I love this approach. I love your approach to diagnosis, but also helping patients, which is being open-minded to what the patients are going through. So many times, for whatever reason, doctors in medical or doctors in dental, they feel like they're the ultimate source of all answers, and they don't listen as much as they could to the patients. And when you've done it long enough, you know that your patient, you could say, you know what, try it, see how it works. If it doesn't work for you, I'm still going to be here. We can take it to the next level. We can help you with this. But a lot of people today are feeling like, well, no, I need to be the authority in this, where I think a lot of patients can promote for themselves what's their best options.
Absolutely. And it's awareness and adaptation. Aware that you're doing it. And then what do we need to do to adapt our system to protect it so we don't hurt ourselves? And that's
Yeah.
what we're looking at, is how do we cause a systematic change to protect ourselves over time so we're not going to get damaged or hurt. And awareness is huge. And so this is a great product that we'll be talking about with Zerine products itself, is, how do we diagnose it? How do we protect it? How do we get it better? And what are the other steps that are involved to get it where the patient's the ultimate source of getting healthy, staying healthy, and keeping healthy? And that's what we're trying to promote.
And it's where it should be, right? Because ultimately this is about the patient, right?
Absolutely.
The customer, the person that's experiencing the challenge, and to some extent they have to own their own problem, but we haven't given them solutions to be able to own the problem. And not to be a broken record, but this is why I was so excited with Zerine, because for the first time, I can wear a simple device that I think is relatively cost effective, and gives me ultimate solutions from not only diagnosing. So I'm obviously pretty aware of what's going on in my mouth, and I don't think I'm a heavy clencher, And yet, when I put this in, I found that there were times during the night where I was clenching much harder than I expected that I would have been. And it just took me, I think, 4 or 5 nights of being self-aware, where I recognized that, hey, I do clench more than I thought I did. And then when I went into the training mode, the device is giving me biofeedback when I clench, and it gives me just a gentle vibration that says, stop clenching. And my body knew what to do. It was fascinating to me. And it really helped from a muscular perspective to kind of decrease some of that tension. And if we're not sleeping great, that's a great indication that, yes, something's going on at night. We need to change.
Yeah.
So it was really cool.
Going into sleep dynamics, there's so many things that happen in your sleep that you're not aware of. And, we know we have lots of testing methods, and we have lots of ways to look at what happens in your sleep. But just the simple fact of having that excessive clenching at night can make it so you don't go into deep sleep or REM sleep, which is reparative sleep, and you're staying in light sleep. And that way you wake up groggy, you wake up, I'm unhappy and my system's not healing. And that's a perpetuating cycle. And it also perpetuates more inflammation because you can't clear the inflammation. So when you have that system, yeah, you don't know what you're doing when you sleep until it can really be broken down and determine what is the best thing for you as an individual. This is a great tool to say, hey, I got something going on. Do I need to seek other advice? Or am I good with where I am because we can help break the cycle? And that's what it is. It's awareness, diagnosis, and what is the best mode towards therapy for that individual patient's needs.
Fabulous. Love it. And just to explain just a little bit, we don't want to get deep in a sleep discussion here, but there's definitely stages of sleep. We know a lot about this now. Deep sleep helps us regenerate our physical body. REM sleep helps us regenerate our brain function. And each one, including light sleep, they're all necessary. They all do a different function to help our body recover, either mentally or physically. And so when we're not sleeping well, we're not recovering physically, we're not recovering mentally. We wake up in a mental haze, kind of that foggy brain feeling. So sleep is so critical in this discussion. And, if we're constantly flexing those muscles all night, we're not going to be getting that kind of sleep that we need to regenerate.
One of the things that we spend so much time, Scott, focusing on our patients, and it's on you're grinding when you sleep, you're clenching when you sleep. We have a lot of ways that we protect that and we treat it. But there's also one thing that we also forget is daytime clenching can be structurally damaging more than what nighttime is. Because as you put your teeth together when you're conscious and you're unaware, then you can actually put exponential force where you actually do micro grinding. We call it micro wiggle. And you can actually cause more structural damage from daytime clenching. Even though you say, oh, I don't clench my teeth, and you're going, oh, my jaw's so tired and sore. But daytime clenching is just as bad, and sometimes worse, because you got more hours of daytime clenching than you do nighttime, that it can be more damaging to the system. So that's why it helps to be aware of when are we doing it? Is it daytime, nighttime, both? Because if that's the factor, you got all these hours that you're sitting there smashing, crashing, bashing your teeth together, causing your structures to be broken down. And nighttime, great, easy to protect. Daytime, harder to protect because you have to do something to protect it and break the cycle. That's why I like about the product is awareness, treatment, and getting the patient, keeping them healthy so they don't hurt themselves.
Absolutely. When you're talking about daytime clenching, I couldn't help but thinking about Hollywood, the classic strong male actor who's in a scene and he's acting tough, and you can see his little muscle here in his jaw firing because that's a tough macho thing.
Hey, I'm that tough macho guy. Watch it now. Watch it. I have these professional masseters here, flex him like nobody. So
that's the Hollywood jaw.
Yeah.
My son, he's a great kid. He's 14. He's just a really great kid. But I catch him every now and then trying to flex his jaw because he thinks it looks cool and makes him looks more manly. I think it's awesome. He's a good kid, but it's kind of
But
funny.
think
Like,
about that flex. Just break it down for 1 second. What if that, when you go to flex and bring your teeth together, your bite's wrong?
yeah,
Okay, and you're sliding that position. Okay, it's going to cause a cascade of effects. One, you're going to have muscle activity where muscles are going to fire equally. Two, you can cause trauma, stress, breakdown to that tooth, the ligament fibers, the bone that are holding the tooth in place. And three, the neurological input going back through the system that you can cause your nerves to get inflamed. And then you can also, by over compressing in the wrong position, hurt the jaw joint, the tissues, cause more inflammation and breakdown. So it is a very severe problem, especially if things aren't correlating and working right. So
yeah,
that Hollywood jaw could cause the broken tooth in the future.
yeah, absolutely,
Yeah.
absolutely. Um, so when it comes to like what could I expect for cost if I go to the store and buy a boil a bite? Am I looking at $400? Am I looking at $100? Am I looking at 50?
I've seen them all across the board, Scott, where I've seen some devices you can buy for 25 bucks. I've even seen some on Amazon. You can buy a sports type bowl and buy for $8. And I've seen them all the way up to $140 to $200, depending on the glitz and glimmer that goes along with those. And so you're looking at is a very broad spectrum of costs that you have from over-the-counter appliances.
What about in a dental office? And I don't want to get into the politics of collusion or prices and all of that stuff, but what would be an average fee for a custom made night guard or a orthotic in a dental office?
That is so open, Scott. So I'm going to give you a very wide range depending on conditions and situations. You can see something all the way from $400 all the way up to $2,000, depending on the condition. As I said, the best thing that is awareness and early diagnosis and treatment. The earlier the diagnosis and treatment, the simpler the treatment can be. Simpler generally is less expensive. So there's, as I said, there's a huge wide variety of that can go for the therapy options that you have. It all depends on how much stuff's going wrong and how much is broken down that needs to get repaired, fixed, and protected.
Absolutely. And most night guards that I see, if you go to a dental office, most night guards by a dentist who doesn't know the joint backward and forward is probably going to be in the $800 range. That's just a general fee. I have seen them as low as $400. You're right, for people that are sometimes milling their own inexpensive, non-diagnostic, non-complex tool in their own office.
Yeah,
But the average is going to be $800, $900 range, I think.
somewhere in there.
Yeah.
Yeah.
And then obviously, when you're looking at somebody that has the experience that you do, then that's going to be that more expensive range. Talk to me just a little bit about like what's the difference between a custom mouth guard made, say, by you versus the one that I could buy over the counter?
So over the counter, as I already said, was something that's generic, that's just going to fit like one treatment fits all type of a situation. It may not position the jaw into the right type of position to establish healing. If it's pushed it into the wrong position, it can cause more harm. And so when we're making them on a professional level in office, we're getting a corrected environment that we're putting the jaw into, the teeth to land into. So it could be more of a custom approach, but you're putting things back into a position where the jaw needs to be into to be protected. A boil and bite, a non-custom one that you buy over the store, it's arbitrary. If you have a pathology that's there and you don't get past the pathology, it's just recreating more pathology because you're not changing the environment. It's just putting the environment back to the same area, and it's just keeping things from getting hit together. So it may not be the overall best treatment for the patient itself, but as I said, it can be used as a diagnostic tool. There's one over-the-counter one that we give out all the time in our practice, and it's called Quick Split. And that's an over-the-counter appliance that you can buy from Oral Pain Therapeutics, that they'll send it to you. And it's a simple type of a thing, but it's used as a diagnostic tool. It's something that, hey, the patient thinks it's there. Well, you can't wear it during the daytime, but it's something that you can wear in a crisis period of time or when you're asleep to see, do you get relief? They're only designed for that magic number, that 2-week type period of time. That's where these non-custom appliances are there. Is it breaking a contraction? Is it protecting the environment, decreasing inflammation? If it does, it makes you feel better. Get to a professional to get something done that's going to be corrective in nature and may not be destructive.
And this is why the whole concept by Zerine is so fascinating to me.
Absolutely.
We use with Zerine, it's a really thin, we're talking about a millimeter thin little protective covering over the teeth with a pressure indicator in it that tells us when we're clenching. So we're not changing the bite. We're not doing any more harm, but we're actually using biofeedback to reprogram. So in a matter of a couple of weeks, we can retrain those muscles to relax and to stop clenching at night. And it's been very successful at that. The data is very compelling that this is actually retraining the muscles instead of trying to reposition. And then we can have a much more stable joint. We see a reduction in inflammation, not only in the muscles, but in the joints space as well.
Right.
So really interesting to me. How long would we expect somebody, if we make a mouth guard or a night guard or an orthotic in a dental office, how long do we expect them to wear that?
Well, that all depends on the situation. Generally, it's if it's a nighttime type of a thing, it's generally forever. And so that's why biofeedback is very helpful. Can you get that patient to be, one, self-aware, two, get their retrained in their environment so it stops the overfunction, and do they have to wear something all the time? If it's a structural anomaly on a patient where the jaw's broken down, you're looking anywhere from a 12-week period of time to a 30-week period of time, depending on how severe the jaw joint breakdown is or the muscle breakdown. So, and then hopefully you can get them into just a protective only type device, just so that you can keep them from having the structure break down again. And so that's usually, once they're into some kind of protection type device, that protection is long term.
And we've needed to do that because that was our solution.
Right.
And so one of the things I love about the things that we're going to talk about next time, which are more of the regenerative options, instead of protective, we're talking about regenerative options. It goes back to that initial conversation, which is form follows function. If we can get the function correct again, then sometimes we can start getting rid of those safety bumpers, right? The night guard for life, because we get things functioning correctly again. And it should be stable at that point. Now, I'm not opposed to wearing night guards to protect an investment because you and I have both done many cases where people have ground their crowns, their teeth down to nothing, and we have to replace the teeth with crowns to replace their bite. So in that case, we definitely want to protect that investment because, crowns can break. And so a night guard might be a good option. But the more we can get away from putting lifetime solutions in place and rather fixing the form and the function, then I think those are better options.
Yeah, and there's a lot to be said about that. Is a lot of these patients come in and they may have wear that's gone through their function that they can no longer function in a protective manner on themselves. And if they say, I don't want to do that and fix that, then we may have to protect it long term because they don't have built-in form to protect their function, and they can continue to hurt themselves. And those are the ones that they're more apt to have to wear something long term, is because they don't have what's in there that's supposed to be in there to protect them from the way they clench and grind, because the structure is already broken down.
Awesome. Well, listen, for the sake of time, this has been an awesome conversation. I love digging deep into these. Next time, I'd like to talk a little bit more about not just protecting, but the regenerative side. how do we promote a healthy joint after we've been through breakdown? So how do we help the body to heal itself in some of these compromising or challenging situations? And I want to continue to relate it to Bruxism, but
Yeah.
maybe we can dig a little deeper on the regenerative side and why we would want to do some of the regenerative options too.
I love talking about regeneration because I love doing that. So because your impact is huge, let's get people smiling the healthy way that they can and functioning the best way they can with their own body.
Yeah. And one of the challenges, I mean, frankly, Western medicine is focused on surgical approach. We have to cut and we have to go in and replace biologic tissues with artificial tissues. And I have a bit of a problem with that. I like the Eastern mindset, which is let's try and regenerate what was lost and prevent it from happening in the first place.
Absolutely.
I know you and I are on the same page there, and especially when it comes to regeneration with some of the things we're doing lasers today, which
Oh,
is
dude.
another fascinating topic. So,
Yeah,
um,
well, we can talk about that type of regeneration along with our other modalities of generation on our next visit. So
I,
absolutely. That will be
I
exciting.
I love it. I love it. Mike, anything you want to promote? Books out, websites, your practice?
No, I'm the biting edge, and for other professionals that are out there, I also am biting education. So have lots of different avenues that are there. And for the patients that are looking for, or the doctors that are looking for their patients to get into a more natural therapeutic pain modality or anti-inflammation type of a product, I have TTP CBD, which is a natural type product to manage inflammation and pain, which, as you know, being somebody that uses it, can really help stimulate your body feeling better and decreasing inflammation. And that's ttpcbd.com, where we have products to help with natural feeling better.
It's an amazing product, and it has made a world of difference for me. And TTP stands for Treat the Pain.
Treat the
TTP
pain,
CBD.
ttpcbd.com. Yep.
Yeah. .com and Dr. Mike Smith at the Biting Edge. If you want to learn more about what he does, and he does teach thousands of doctors around the world on pretty much on a weekly basis. I think you may travel just as much, if not more, than I do, my friend, and that's a significant statement. So,
Yeah.
in closing, I would encourage people to check out Zerine as an option because it's one that you can do yourself and start getting that little haptic feedback that tells you when you're clenching and start retraining yourself. And also these upcoming podcasts, we have a couple now on the books to do. Next time, we're going to dig deeper in regeneration of the joint, and we'll talk about all kinds of other things. It's really exciting, Mike. I appreciate your time. Thanks to our host Zerine for hosting this and helping us come together and talk about teeth and clenching and grinding and all the wonderful things about tooth truth. I love it.
Excellent. All right. Well, let's be aware of our grinding solutions and make Zerine people smile.
I love it. Love it.
All right.
Thank you all who've listened in, and we look forward to seeing you again in a future episode. Thanks for your time, Mike. I appreciate you.
Thank you, Scott. Have a wonderful day.
Thank you.